Hey guys, so this video will be on the discharge process. And so first we're going to talk about kind of what to do in the morning for the patients that you're anticipating to discharge that day. And then after we'll go over how to put in the discharge orders and then kind of everything in Cerner in order to kind of safely discharge them. And so first, kind of like we talked about in one of the first videos, if you're anticipating that a patient's going to go home that day, you need to see them not thing in the morning. First, you need to see potentially any potential unstable patients, but then after that, the next ones you'd see are the patients you're wanting to discharge. And then you need to kind of start coming up with a plan. So that can be anything from, like, for our patient, the patient's been on oxygen. So going back to kind of the case we've been doing, our patient with the CHF exacerbation, they've been on oxygen. So we've been weaning that. So one thing that we need to do is order an oxygen walk test so the nurse can walk with them and see if they can do well without any home oxygen. If they did require home oxygen, then we would need to talk with case management and get that set up so that they can go home with that. And then we also need to kind of, and you don't, it kind of depends on which attending you're working with, but some of them might want you to text them in the morning, or you could text them anyways and kind of just ask like, hey, are we thinking about discharging this patient? Just so you can kind of get going on things. But start thinking about their medications as well. So for our patient, we've had them on IV Lasix here. And so my plan for this patient would be to send them home on a higher dose of Lasix. Say your patient came in with an infection, and they're on IV antibiotics, then you would need to kind of plan this before round so that you have a kind of a good plan to present, but plan which antibiotic you're going to switch them to, because you can't send them home well, you could if they have like a midline, but generally you would send them home on PO antibiotics. So you need to come up with kind of which PO antibiotic you would do for the patient. Let's see. And then so we talked about talking with case management, also talking with the patient and making sure they know they're going home and kind of have some support if needed, like social support at home. And then you may need to talk with the family, and that might require a phone call. So those are kind of the things to go over before actually putting in the discharge orders. And then never put in a discharge order before running it by the attending. So generally you would do rounds, and then either during rounds or right after rounds, this would be kind of one of your first priorities is putting in the discharge orders. The note isn't as important to do like immediately unless they're going to a skilled nursing facility. I believe most of them require like the discharge summary note completed, and they have to kind of send it with the patient. So those ones you would have to do right away. So let's go into the actual computer parts of this on Cerner. So there's kind of two parts. So one is the discharge order, or it's an order set, and then the last part is kind of a bunch of other boxes we have to click. So you go here, and then I have it saved as a favorite, but it's called hospital discharge orders. So let's see. It's kind of like the admission order set. It's a lot simpler though. So for our patient, this box is obviously you have to check this because that's the whole point of it, is to discharge them. And then you can click whichever one fits your patient. So our patient is going home independently. If they were going home with home health, then you would click home with home health, and then you would click which specific home health services you're ordering. So this could be just basic medication management. I think this would include like a nurse coming to their house like 3 times a week for an hour each time to help them manage their medications. You can do, let me see, I believe wound care is on here if they need that. Yeah, wound care. One of the most common ones we do is like PT and OT. Yeah, so you can, or like if they're sending them home with a PICC line or a midline maybe for antibiotics, that would be one. If you're sending them home with a Foley catheter, that's one, but you can look through those. And then if they're going to a skilled nursing facility, you'd click here. It automatically clicks the certification thing. And then this would be the one for an LTAC. Let me unclick these. So for our patient, they're going home independently. And then I'm going to check this. Yeah, we want them to check their weights every day since we're kind of worried about them getting volume overloaded again. They have diabetes, but they're not on insulin. This patient's just on metformin. They don't need to check their sugars at home. There's no wound disorder here. If you'd like to write some instructions for the patient, you can pull this up and then write in some instructions for kind of whatever you'd want to. And then these next ones are for like different lines and stuff that the patient might have. So our patient doesn't have any of these. Our patient does have a peripheral IV, so we're obviously going to discontinue that so they don't go home with it. Let's see what else. As far as restrictions, our patient doesn't have any restrictions, but these are kind of some different ones. Like maybe if they had a seizure, you could say no driving, or if they were seen by PT and they give specific restrictions, you click that. So let's see, for the diet, this patient would need, I guess, a cardiac. I don't know if you can click 2 on there, but let's see, a cardiac diet, and then if you hold control, and then like the diabetes diet as well. So we did both of those. If they're going home with oxygen or any kind of special O2 stuff, you could click this and then you could type in specifically what you have to click it and then it opens. Let me see. Modify, you would type in specifically what you want, like say oxygen at night at 2 liters or oxygen with activity or whatnot. And then you can click or you can order. This would be outpatient PT. If it's the PT with home health, like we talked about it's an order up there. And then this would be if they're going to a skilled nursing facility, this kind of tacks on this order so they can immediately start getting their PT or any of these other services right when they get there. They don't need to be seen by another doctor in that facility in order to get the order. If you click that, our patient's not going to there. They don't need outpatient PT. Oh, and then one that I skipped was the cardiopulmonary rehab. So this, I feel like it's kind of underutilized, and this is, I believe, one of the quality metrics here in the hospital. So since our patient just had a CHF exacerbation, I'm going to click this one. And then this one actually, there's several different indications. You generally should use it for discharging any patient who had like a heart attack, or MI, so like a STEMI or an NSTEMI or stable angina. There's other indications too. So a CHF, like moderate to severe CHF, interstitial lung disease. And obviously you'd have to look up like the contraindications and run it by the attending. But for my patient here, I'm going to do this one because they have systolic heart failure. And then they should get a call to kind of set up and schedule their cardiac rehab. And that's located in a building behind the hospital where they do that in the gym area. Oh, whoops, let me move this out of the way. All right, so that's all the orders for this patient. So now I'm going to sign this. Sign. And now, so that's kind of the first part. And then the second part, you go to your main workflow page and then click discharge. And then basically for this second half of it, you want to make all these red stars, you want to turn them all into green check marks. So the first one, we've already done the problem list, but you could just go through and verify and just make sure that the problem list is accurate. Like we were saying, say the patient developed pneumonia during the hospitalization and then no one ever added pneumonia to the problem list. Just make sure that that's on there, and then make sure the order is correct or order looks good of these. And then this is the discharge orders that we just barely put in. Next is the med rec. This is probably the most important part of the discharge process. So for the med rec, what this means is we're saying kind of which medications they need to continue, and then we're also actually writing prescriptions for their home meds. So as far as these tabs, we filled these out when we admitted the patient. Transfer, we don't use this button. And then the only reason why you would choose or click this one, discharge to next level of care, is if you're sending the patient to our ARU unit, which is on the second floor of the hospital. Any other discharge though would be this one, discharge to home. So whether they're going to their house, whether they're going to a skilled nursing facility, a long-term care facility, or if they're going to another hospital, like if they're going over to MUSC or Grand Strand, then you click this one. So for our patient, we'll click this. And then this looks similar to the admission med rec or admission med rec, except it's got this middle one. So what this one is that you can prescribe an outpatient prescription. So we'll generally, unless it's like a controlled substance, we'll generally give them a 30-day supply of the medication. If we even need to give them a new prescription of something, and then we won't give any refills because they need to follow up with their primary care doctor to get refills. So basically you just go kind of straight through this. So our patient, so we want to continue the metformin, continue their home atorvastatin. Anything that's like a hospital one that you don't want at home, you can just leave blank. And then at the end, you'll click do not continue remaining orders. And then it'll just automatically like discontinue those. So yeah, continue their home Lexapro. As far as the Lasix, so I'm gonna increase this patient's home Lasix up to 40 milligrams. So I'm gonna give him a new prescription. So you can either discontinue this one and then go up here and write him a completely new prescription, or you can just go here. It doesn't always work, but you can go here and then increase the dose, 30-day supply. Let's see. So yeah, Lasix 40, and then it's for a CHF exacerbation. Duration 30 days, 0 refills. And then you go in here and then kind of find a pharmacy. And then you can do, if it's on a weekday, so Monday through Friday, and like I think it's before 5 or maybe 4:45 p.m., you can do the CMC pharmacy, outpatient pharmacy that's downstairs. And then you can put in the comments, you can put in the comments like, please bring up to patient's hospital room and say 304. I think this just froze. And then, send that in. Right now, it's just going to send it to a printer. Let's see. So we've got that one sent into the pharmacy. We're going to just continue their home metoprolol, continue that. And then the rest of these are just hospital meds, as you can see by that icon. And so, and then just review it. So that's what we want. And then click this one. And then you can see that kind of X'd out all the ones that I left blank. It discontinues, and then I'm going to click sign. Let's see. Okay, good. So that turned this one into a green check mark. So the medrec's completed. A lot of times, or some of the attendings will actually like go through this with you just because it's so important and you don't want any mistakes. Other attendings might prefer that you like text them right after you did it, and then they'll go through and review it. So the next section here is patient education. So, and you have to have at least something for this. So I'm going to click this one, and then let's do heart failure. And then since we're sending them or referring them to cardiac rehab, let's click that as well. You can also change the language on here. And then you can also click the plus sign, and then kind of type in other diagnoses if you don't see one that you like here. Okay, and then the very last part of this is follow-ups. So if the patient is seeing a CMC primary care doctor, then that primary care doctor's name is going to come up here. You're always going to see your own name here as well. If you're one of the FM residents, you can, if you'd like, you can schedule them with you, like to see you in a week or two in clinic. If they already have their own primary care, I would just have them go back to them, but sometimes they can't get in for months, so they need to see somebody. You can also type in a doctor's name, and then you can put in a location, like say we want them to follow up with our cardiology clinic. So the Conway office has the most providers available. Let's say we want them to follow up with the cardiology and say like within a month or so. Let's see. And then you can type out notes. Whatever you write in this comment section is going to go into the patient's paperwork. And then if the patient already has an appointment, say the cardiology or say the cardiologist saw the patient during this admission, or the patient like already follows with cardiology and they have an appointment scheduled already in a few weeks, you can still put in like this just so it kind of checks the box, but then you'd say like appointment scheduled. So then it tells the schedulers that they don't need to schedule another appointment. But yeah, this patient's never seen the cardiology, so I'm just gonna do that. So see our office within 1 month, and then this kind of, let me see, this will tell the cardiology, or it'll tell the scheduling people to actually make the appointment. And then let's say we want them to schedule just with a CMC primary care doctor. Then I'll put this in, and then let's see. Let's do like 1 to 2 weeks. Well, no, actually 1 week, because I'm upping that dose of Lasix, and then I want them to check the electrolytes for this patient. There we go. So then they should schedule within 1 week with one of our primary care doctors here. Yeah, so I think that's the end of this section. So all these boxes now are green, and our discharge order is in. So basically at this point, once you finish that, then the nurse can print off the paperwork. So it prints off basically a bunch of different things from each of these sections. And then the nurse will go in the patient's room and then review that with them, and then they can kind of get them out the door. And so the next video will be the last one, kind of in this section, and it'll be on how to do the note